So these are the two questions. We just want everybody to take this poll. The first question is, innovation is important in the COVID-19 response, yes or no? Uh, so just select which of the responses you agree with. And just to state that the panelists won't be able to take this poll, so all the participants are taking the poll apart from the panelists. Then the second one is, what aspect of the COVID-19 response needs innovation the most? First option is laboratory diagnosis / logistics. Second is social interventions / palliatives. The third option is social interaction / distancing. The fourth is combating misinformation. Then the fifth is none of the above. So it'll just take like 30 seconds to, respond to the poll. So we'll look at the result, and hopefully that would help guide the discussion for today. Awesome. So we have 63 participants that responded to the poll. 100%, everyone, feels that innovation is important in the COVID-19 response. So what aspect of the COVID-19 response needs innovations the most? As you can see here, laboratory diagnosis / logistics. Abasi, I'm sure you're very happy with this result. 29 people, that's 46% of the participants feel that laboratory diagnosis / logistics is the most important, followed by social interventions and palliatives, 21%. Same with social interactions and distancing, 21% too. Then combating misinformation, people, just 11%, 7 people feel that should be the most important to address with innovation. That kind of worries me because I know the harms that misinformation can cause. Well, one person felt that none of the above was important to be addressed by innovation. Yeah, so thank you so much for participating. I think this kind of would help our speakers speak about innovations in their own space. So I won't take any more time. Let's just dive into it. So Abasi, over to you. You have 5 minutes to talk to us about your innovation within your own space and highlight anything that you feel is important.
All right. Thank you, Ifeanyi. Good afternoon, ladies and gentlemen. My name is Dr. Abasi Ene-Obong. I'm the CEO of 54 Gene. We're a company that was founded last year. We're a research services and development company, one of the first in Nigeria. And I believe that we were lucky, let me put it that way, in the sense that prior to COVID-19 happening, we had already started doing molecular research in the country. And so we had a molecular diagnostics lab. We'd already recruited, staff, well-trained staff before the COVID-19 crisis hit. So we were sort of conversant with, we had clinical microbiologists and staff. We had the right type of people to handle the crisis. But we also understood some of the main issues affecting testing and diagnostics in Nigeria. Some of the issues include that we didn't have clinical diagnostics labs in Nigeria that were doing molecular diagnostics. So using PCRs, or at least we had very few of those labs. And so by the time the crisis hit, Nigeria had somewhere around 200 or so tests a day capacity. Now imagine that a country of 200 million could only do somewhere around 200 to 300 tests a day. Because the biggest labs in the country had already been sending samples that required molecular diagnostics outside Nigeria. So the entire country was caught unprepared. What we did, how we tried to innovate there were 3 ways to do it. The first step was, let's partner with public agencies, right? So let's work together with the public labs. And oh, thank you. That's a beautiful graphic for us. And the first was we raised a fund from private sector partners. And the purpose of that fund was to equip government labs. And so with that fund, we've bought quite a number of PCR machines. And essentially we bought low throughput PCR machines, 48 sample format, all the way to high throughput PCR machines, 384 sample format. What that means is on the low end, you can do 40 tests at once every 2 hours. On the high end, you can do nearly 400 tests every 2 hours. And we partnered with government labs to install these instruments in the labs. The second part of what we did, so obviously when we did that, we also had our own lab in Lagos that we were already using for our research purposes. We then modified that into a COVID-19 lab. So we took out the bulk of our equipment and put in storage, right? And said, you know what, the priority for the country was COVID-19 tested. So we actually had to turn down some of our other work just so that we could provide some support. And so we got into the Nigeria CDC network to start providing testing. But that was in Lagos. And we saw that there were other parts of Nigeria that needed tests. Now, what people really need to understand is that this whole testing issue is multifaceted. One is the fact that we don't have the right equipment in the country, right? And so we now had to start procuring equipment to bring to the country. Two is the fact that we don't have enough trained people, enough people that know how to do PCR in the country. Because most Nigerian universities that have taught PCR type-based techniques theoretically never taught them in practicals, right? So most people who went to Nigerian universities who understand molecular biology don't know how to actually do the practical aspect of it, right? So we now had to start recruiting people that have the skill set, whether they are Nigerians who have studied abroad or some of the Nigerians who have managed, who have worked for some of the other well-funded and resourced research centers in the country. We now had to start building this workforce. And so what we did was we launched this first mobile COVID-19 lab, which was a molecular diagnostics lab in a container, in a shipping container. And in that, you have everything you need to run a molecular diagnostic test, complete with solar panels, right, to provide power, right, 24 hours. And in each of those labs, we have 3 to 4 well-trained people who can actually run the tests. And so we partner with states and other private sector payers, because in many cases, the states can't fund some of these tests. And so a private partner comes in and says, we will fund this state to have a lab, and we will also fund some of the tests going into that state. And so we've done that now for Ogun State, we've done that for Akanno State, and there are a few more states that don't have any molecular diagnostics lab, which, because of what we're doing, can get one that is already validated by the NCDC. Now, the next phase of where we are going to, in addition to making more mobile labs and spreading them across the country, the next phase is automation. The reason that we still have very few tests in Nigeria is because almost, if not all labs in Nigeria still operate manual processes. And even if you have a PCR that can do 300 tests every 2 hours, you can't capture that additional capacity because you're restricted to your manual process that allows you to do only about 24 samples every hour. And so we are now in the process of installing automation in our Lagos lab. And we've also, through the fund we raised, procured some automated extractors for 2 of the key government labs in the country where some of the biggest number of cases are. Hopefully sometime next week, we will start installing those automated extractors. And in addition, with the high capacity PCRs, we think that within the next 1 or 2 weeks, we can get Nigeria to a place where we totally double our testing capacity in the country. And that's what 54Gene has done so far.
Okay, thank you so much, Abasi. Thank you, thank you. Thank you for disrupting the space, the laboratory space, your commitment to the work. I think it's safe to say that you're proudly Niger. As it is, you're also helping improve the human resource for this test in the country. So we'll move to Collins. So Collins, I mean, there's this popular saying that we are what we eat. And I mean, you're one of the top nutritionists in the country. So so in 5 minutes, just talk to us about what innovations you've used to do the work that you do.
Okay, so I wanted to just quickly share with us what we have in Communeating, or what we are doing at Communeating. Communeating is actually a CSR initiative of the company I founded, diagnostics.com. What we do is try to scale up nutrition awareness and education in Nigeria. We make an attempt to do that through programs, well-designed programs, and seminars in low and middle income communities. So earlier this year, we wanted to do our usual April edition of the community outreach we usually do, community nutrition intervention outreach we usually do. But then we were struck by the COVID-19 pandemic. And then we never knew that we were going to inspire that much passion in our volunteers when we threw it out there saying, okay, guys, what do we think we can do this period where there's social distancing backing us down from reaching out. There's a challenge with getting around Lagos even. And funny enough, for the first time this year, we actually extended our intervention across other states in Nigeria. So how were we able to do that? We leveraged on technology, current technology everyone can access. I'm talking WhatsApp groups, I'm talking even graphical polls like what we just did here now. So we have an online community. It's a forum whereby people who are food producers come, they sign up for free. If you're a nutritionist, you come sign on the platform for free to give consultation and free assessments when we do the community interventions. So this platform has already been in place, but this year's April savings event couldn't happen because of the social distancing problem. So we said, well, what can we do differently? We decided to adopt remote volunteering. That means people are actually volunteering on the cloud. It's simple. You join in through WhatsApp groups, you join in on the platform. So we decided to make 3 categories of people who are going to be involved in this intervention. The first one being the foodies. I'm coined from the word food health enthusiast. So these foodies are all on a platform. It's communeating.diagnostics.com. It's a website. They're on this platform and they have a WhatsApp group. So if you're interested in making a very lovely poster of yourself and calling on a few friends to sponsor a family's food bag this April period, you just make a poster by yourself. You don't need to even call a graphic artist. Everything is online. You make a poster, you post your poster on social media, tag a few friends, and you guys can aggregate funds together to pay for your family's food bag. We put the tag for a family's food bag at 5,000 naira. It has staple foods, a whole lot of good staple foods, half pints of rice, beans, yam, and so many other things. Now you call on friends together. You guys can sponsor a bag, or you can sponsor more. If you're looking to partner with the event, you can actually you'll be listed on our website. Everything is happening on a web page. The volunteering, the poster making, all is happening on a single web page. We're also getting real-time and 24-hour reports from the community chiefs in the intervention areas. So the volunteers who are on the field are called community chiefs. The ones who are volunteering online are called foodies. There are people who are logging food item donations because surprisingly, Nigerians are so passionate that even in this lockdown period, some people are willing to give out food items and then we go get them. So we partner with a delivery company, Send. They help us pick up these food items from the families who are looking to give out. Just 3 days ago, we received 30 crates of eggs from a farm all the way from outskirts of Lagos anyway. And then people are donating, sorghum, people are donating cereals for babies. Okay, so we're getting all of these items to the food banks. The food banks is on a WhatsApp group. It's a mobile food bank. So they just log the items received. The delivery companies, we call them, they go pick up, they bring it to the food bank. Then we discuss with the social media volunteers, the foodies. Oh, please guys, let's make more posters. Let's call more friends. And so far, we had a target of feeding 500 families, but we've been able to secure food bags for about 82 families. And we wanted to end this program by the 30th of April, because it's actually an April program. But surprisingly, we are still receiving food item donations, okay? And we still have to call those volunteers in the localities to get this item. So we're leveraging on technology to make this volunteering experience totally online. And then we educate these intervention guys on the field, the community chiefs, on social distancing guidelines, so they don't have to interact closely or expose themselves to risk. So that's what we're doing.
We'll move quickly to Professor Lynn from South Africa. So Lynn, good to have you on board. Thank you for making our time. We know how busy you are, leading the agency in South Africa. So just briefly introduce yourself to the participants, and talk to us about some innovations, you've adopted in the work that you do.
Great, thank you very much for this invitation. Yes, so my name is Lynn Morris, and I'm the Interim Director at the National Institute for Communicable Diseases, which is the National Public Health Institute in South Africa. So, we've been coordinating the outbreak response. I guess maybe just to give you a little update on where South Africa is, we had our first reported case on the 5th of March, so just over 2 months ago. And the initial cases were all in travelers who had returned from Europe. And about 3 weeks after the first case, we implemented a very stringent lockdown. And we are still in lockdown, although it was eased a bit in the last week. But we've been in lockdown for almost 6 weeks. So as I'm sure you can imagine, that's had a dramatic impact on our epidemic curve. So as of right now, we have just under 8,000 cases in South Africa, with sadly 153 deaths. But the general feeling is that this would have been a lot higher if we hadn't implemented the lockdown. Just to say that just to really focus then a bit more on the NICD. So the NICD is a division of the National Health Laboratory Service that runs all of the laboratory testing sites throughout the country. And I think one of the things that's been quite remarkable is how, the health system that is there to support HIV and TB work really has been used to manage this outbreak. And so a lot of the sites and a lot of the systems that were set up, to manage the HIV epidemic. Of course, I think, for us in Africa, that's still one of the big issues is what the impact is of HIV and TB. And of course, we have lots of, research initiatives to really try and understand the interaction between those diseases, because that will have a big impact, on our continent. So the NICD is really, it's responsible for doing surveillance. So one of the other things that, that we do is routine surveillance, and so for respiratory diseases. And so we've been able to plug into some of those routine surveillance programs and start monitoring, for the presence of COVID. So that's really giving us a good sense of where we're at. And I guess also just to say we have a community program. So we've actually gone out into the communities to actively look for cases. And then those cases then get referred. So it's been a very active program, to try and contain this epidemic. And I should say as well, with a lot of contact tracing and isolation and quarantining. So obviously as the lockdown starts to to lift, we are going to start seeing more cases. But we've had plenty of time, like many countries, to prepare for that in terms of, preparing the hospital services and field hospitals and also quarantine and isolation facilities. So to also maybe just talk a little bit about some of the molecular epidemiology. So we've been sequencing the virus, and I'm sure many of you are following this because it's being done real time. People are sequencing the virus and looking at how it's changing. And just to say, on the African continent, actually, there's been some quite really remarkable progress. The Congo, in fact, has done really well in terms of doing a lot of sequencing. Senegal and Ghana as well, and South Africa as well has contributed some sequences. But this is so we can really monitor the virus as it spreads and as it evolves. I guess just to say that remarkably, this is not like HIV, because I come from an HIV background, and it's certainly a much more stable virus. And so we're not seeing a lot of changes. So in terms of thinking about vaccines, that's a good thing, that it's a virus that's not a moving target. And of course, the issue of vaccines is something that, we're all anxiously, waiting to hear about, because, that's really what we need to stop this, this epidemic. Maybe just to highlight one of the other things that we're investing a lot of time in is the serological assessment, because, right now, I think we all know that PCR testing is the way to diagnose this infection. And I think that will, likely remain. Simply because it takes a long time for antibodies to come up. But just to say, there's a lot of effort in really evaluating some of these rapid antibody tests, because they will be useful, particularly if we really want to know what the proportion of the population is infected, the denominator. But there's also very important studies that need to be done. A critical one is also understanding what these antibodies mean. Does it mean that you are protected and so you won't get reinfected? How long do they last for? Are they induced by vaccines? So lots of questions. Once we develop these serological tests and also neutralizing antibody tests, so that we can support vaccine development. And again, just once again, I think Africa in some ways, because we do have a lot of well-developed programs to deal with with HIV, is that we've harnessed some of that. Some of those platforms and some of that expertise, we brought it on to, to studying COVID. So that's it for now.
Okay, thank you so much, Lynn. Absolutely. I like the way you ended. I think different African countries that are dealing with different infectious disease outbreaks have built capacity, that have been harnessed, to address COVID-19. Thank you again for making our time. Thank you for the work that you do in South Africa. So I'll just go to Q&A and start with the question that has the most votes. So the first question is for Abasi, Dr. Abasi. It says, what role can the private sector, for example, 54Gene, play in improving the quality of graduates in the health sector? Is it possible to influence the syllabus, the syllabus of content of different training schools in the country? Abasi, over to you.
That's a policy type question, influencing the curriculum. But something we are actually about to do, and we just had a discussion about this yesterday at the company, is that we are about to announce a training program. What we are finding is that there aren't enough people with experience, 1 to 3 years experience doing PCRs in the country. And so the next set of people are, people who have theoretical knowledge, but don't have the experience. And so we're about to set up a sort of fellowship program or of sorts, where we will take in people with theoretical knowledge and then take them through a program, teach them the basics of, pipetting science, and then get them into the PCR lab before we then deploy them to states or to labs across the country. We understand that COVID-19 is not going away anytime soon. It's not going away in the next 2 months, right? So the reason we are doing that as well is so that we can start planning ahead, for the next 2, 3, 4 months, so that we have enough people to support this long fight. And by so doing, also giving them the skills needed, and also giving them a way to earn an income as well.
So actually, one of the main things that we did, because we started getting ready quite early for COVID, because obviously we knew it was coming, we started preparing well in advance, actually, about 6 weeks ahead of our first reported case. And one of the main activities actually was training. We trained thousands and thousands of healthcare workers and provincial Department of Health people to then, do trainer sessions, because this is a new virus, and so we had to let people know of course, we didn't know too much. We know much more about it now than then, but to really let people know what we knew about how respiratory viruses are spread, and of course the important prevention messages to get them out there. But of course, that has evolved incredibly, since the start of things. I mean, the issue of masks is one example. At the beginning, masks were not being considered, and now, of course, they've been used very widely, including in Africa. So things are, moving very rapidly. So okay. Training has to go on all the time. Yeah.
Okay. Thank you so much, Lynn. So the second question is that addressed to Dr. Abasi, but after he responds, I think Lynn, I also want you to respond after Dr. Abasi. The second question is from Dr. Atinuke. She's a pediatrician. It says, this question for all panelists, especially to Dr. Abasi. I've been seeing a number of people stating that they have rapid COVID tests from Germany for sale. What do you say in regards to this, and how safe is it to buy from these people? Okay, Dr. Abasi, you first, then Lynn can respond.
Okay. I think what Lynn had mentioned was that South Africa is doing quite a lot of serological work to check, to understand antibodies and all, and essentially most of these rapid diagnostic tests are also serology based. The issue is that many of them have really low specificity, and it's not recommended. I know that there are groups internationally that are trying to increase the accuracy and specificity of their own particular solutions. But I typically would want to caution people, because there's a flood of those RDTs out there, and everybody claims to have something that works. In Nigeria, the official stance is that it's not approved. It's not approved by the Nigerian CDC, the Nigerian government, the WHO, and so we recommend not to use them. Down the line, we're going to have more accurate ones, and at that point, yes, we'll probably start using them.
Second, that point that that there are a lot out there, and some are. I mean, in fact, we have approved. From a couple of days ago, we had approved one, but I know that there were others in the pipeline ready for approval. So I think the important thing is that each country has a very stringent validation process before these are used more widely. And it's also not just the rapid tests for use in the labs. It's also home tests. And I think there's a huge problem of if those tests are used by the public and they're not reliable. It can just cause a lot of unnecessary panic and fear. So definitely they need to be well placed. There's no doubt they're going to be useful, for seroprevalence surveys and for vaccine studies, but we're not quite there yet. So watch this space.
Okay, thank you so much, Lynn. So I have a question for Collins, and it's similar to the first question that Abasi and Lynn responded to. You're using technology to harness the power of community to improve nutrition, in the country. To what extent do you work with students? How many of your volunteers are students, and Are you intentional about involving students in the work that you do?
Yeah, we're very intentional about having students join in on the volunteering experience, because then again, we've also considered the fact that in building up their resume in this period of the lockdown, they can actually commit to some higher causes, something tied to the Sustainable Development Goals. At least we know that SDG 2 talks about zero hunger. We're trying to connect the youthful mind to higher causes in the society. Just about a month ago, there was a youth consultation for healthcare technology and how the youth can actually be part of the universal healthcare coverage when it comes to doing something that actually tailors to them. So we always welcome students wanting to be part of the cause. Yes.
Okay, thank you so much, Collins, because I think that's very important, really, because I feel that one of the best ways for people in training to really get to know the work, and hopefully be inspired for them to innovate in the future is if we involve them at this stage of their training, so that they get their hands dirty as quickly as possible. So the next question is from Dr. Chik and Yetok. We know her very well. She's one of our partners. Her question is directed to Dr. Abasi. She says, awesome and very timely work. Another evidence that opportunity plus preparation equals success. Is Akwa Ibom one of the states you are setting up a lab for?
No, I don't know. I can't reveal that now. I know that, I can't reveal that now. Okay. It's the states that, the partners will determine when, if, and when they want it to be known. Yes.
Okay. So Abasi, let me turn the question the other way. If Akwa Ibom State approaches you to set up a lab, is that something you would do?
Of course. We are not selective of states. The goal is to get as much testing, a testing facility in many states. Akwa Ibom probably has about 5 to 6 million people. Mm-hmm. And when you think that a population with nearly 6 million people does not have a lab to test, it's something we want to do, so we're not selective. We are willing to work with all states and try to get them, testing. So yes, we're open to it.
Okay, thank you so much, Abasi. So the next question is for any of the panelists to respond to, actually, and it's from Zachary Ishiaku Osheku. He's the Executive Director of PAC Initiative Africa. His question is, how do we ensure that infection prevention and because what COVID-19 has thrown up again is how something as simple as this infection and prevention protocols have been neglected over the years. So his question is, how do we ensure that this becomes an integral part of primary healthcare system, and really whether in Nigeria or South Africa? So maybe let me start with Lynn, because I'm biased towards women.
COVID is teaching us a lot of things. One of the other interesting things about this during the lockdown and our surveillance programs is that we've seen that actually we had less influenza and less RSV as well, simply because the viruses are spread via the same routes, and so I think there's going to be long-term sort of spin-offs of this process, and people are going to be much more aware about personal health hygiene, about staying home when they're ill, and about the importance of washing their hands. So I think there will be those positive messages, going forward, because influenza is also a very serious illness, and in South Africa it kills 11,000 people a year. So these messages are important to get across.
When you come to a country like Nigeria, where we don't even have many labs for surveillance, right? So what this is calling out to us is that we need to start doing more disease surveillance. We need to start also prioritizing, whether that's viral diseases or non-communicable diseases that require these types of techniques. The issue is that typically, like I said before, typically in Nigeria, if somebody had hepatitis B, in order to get that hepatitis B viral load, most people will send their samples outside Nigeria, right? So how do you have a good health system when you're sending hepatitis B samples, hepatitis C samples, cancer samples out of the country? So all of this is beginning to tell us that we as a people now need to start really valuing our health. We need to stop taking shortcuts and, investing in infrastructure and investing in training to ensure that we can actually begin to be the people who do this surveillance for ourselves. And by so doing, people will know a lot faster and a lot better, what it is that ails them. I mean, we're talking about COVID-19, but this same issue of the lack of labs is what is leading to a high misdiagnosis in Nigeria, where everybody that goes to the primary care system gets a diagnosis of malaria, right? But because you can't tease out what is hepatitis B, which will present with similar symptoms as malaria. Everybody who goes to the primary care system is told malaria typhoid, but there's a host of other diseases that it could be, right? And so hopefully, and it's a sad thing that this is what it's taken us to get here, but hopefully the capacity and infrastructure that will be developed in Nigeria because of this will help us really get to provide the actual needed care to patients in the primary care institutions.
Okay, thank you so much, Abasi. So Collins,
yes.
So one of our partners, Professor Uche Amazigo, who years back was also the director of the WHO Africa program on onchocerciasis, she says something. It's good to feed people. It's good to know how to wash your hands. You don't have water to wash your hands. It's pretty much a waste of time. And I think it links back to this question that Isiaku asked about how do we link infection prevention and control to the primary healthcare system? What's your thoughts around that?
Okay, so first of all, I want to borrow a thing or two from what the previous speakers have said. Yes, when you look around, you will see that Nigeria is really challenged when it comes to infrastructural development, things to enable us to get there and get better. Now, I would like to say for a proper healthcare reform that is sustainable, there's a lot of neglect on nutrition as something as a tool for preventive healthcare reform. I feel in any healthcare reform that is sustainable, nutrition should always be talked about. The reason I said this is this. There has been a change in medicine from the disease and cure approach to prevention. And you said to question yourself that we are what we eat, right? So there's a serious need for attention to be paid to nutrition and nutrition awareness and education. What we do in communities is actually to scale up nutrition through educating these people and, of course, providing food relief, okay, like what we're currently doing. So in this program, we're currently having April savings, family for family. We are educating these people on how to follow the COVID-19 safety guidelines of washing your hand and cleaning your food surfaces in the kitchen, in all of those things. And then we're also letting them know that there's a way to actually eat optimally, eat healthy, have healthy eating, healthy nutrition, even on a low budget. So we're educating them on how to eat healthy on a low budget and how you can get these nutrients you need from your local foods. Now, currently, there is no diet or supplement that can prevent one from being infected by COVID. But we know that there's a way you can eat in this period that can support your immunity. So we do well to educate these people through our social media platforms and, of course, through the ways we've been reaching out to them.
Okay. Thank you so much. So obviously we can't take all the questions, but I want Lynn to answer this last question. Then each panelist will have like 30 seconds to give us their parting words before we end. So Lynn, the question is, It's from Paul Adepoju. He's a journalist. He writes for very prestigious platforms like Nature and all the rest. The question is, I would like to know the local innovations that South Africa is deploying in its response to COVID-19.
Well, there's a lot of things going on. I mean, one of the things that they're going to be doing is using mobile networks to track and trace people, for instance. To really be able to to figure out where people are and to find hotspots. And so that gets combined also with doing some modeling work to really, try and identify the hotspots and go in there and try and contain the outbreaks.
Okay, thank you so much, Lynn. Okay, so let's start from Collins, then Lynn, then Abasi. As far as innovations in responding to COVID-19, what are your parting words? What would you want our participants to take away?
So what I would like to say is, we all have seen that coronavirus is a novel virus and it has hit us really bad economically and otherwise. I believe for us to get back to normalcy and things to go back to normal, we have to adopt a collaborative approach towards this. I mean, the people, programs in place, and government policies all have to come together to help us, get out of these dark times. So I believe truly what we're doing at Communeating is touching a lot of people, is impacting people. You can still be part of this by just going on our platform. It is totally online volunteering. You don't have to go there. We already have people stationed at these areas, 8 states in Nigeria, who are ready to reach out and make sure that beneficiaries get what we have packaged for them. So you cannot just be part of this. It's totally online, and just do something that affects the next person and sheds a little light of hope to the next man. Thank you very much.
Yeah, just to pick up on something Abasi commented on about kind of Africa.
Sorry, go ahead.
Has got a dependence on the rest of the world to get things done, and that's been very acute in this crisis. I mean, just getting the test kits, for example, has been really very tough to make sure that we can actually measure this. So I think our manufacturing capability really needs to be invested in. And I guess just to say, that where there are these sort of desperate shortages, innovation really comes. People do develop new and cheaper, better ways of doing things, and whether that is new tests or whether it's new treatments and vaccines, I think we are going to see a lot of new, cheaper, better ways of doing things in the coming months.
So I agree with Lynn perfectly that we need to improve our manufacturing. We need to start looking at ways we can support most of what happens in Africa within Africa, because it's really been difficult competing with well-resourced countries, when you don't even have the resources to compete. But what I want to say about innovation in the time of COVID is that all of us have to innovate. It's a new way of life for every single person, right? And so we have to just start thinking about ways to do things better or different to survive, what is happening, and that's innovation. So whether it's in your personal life, you just need to think differently. Whether it's in your work life, it's going to change the way we work. We're already thinking about hot desking in our company because of COVID-19, because apparently our staff was able to work and they were productive during the shutdown. And so, rather than opening a second office, we are thinking we can hot desk and save money, so there are various things that we do. I think we need to embrace change and just look internally and also look externally to see what you can do to make your neighbor's life better.
So once again, on behalf of Nigeria Health Watch and EpiAFRIC, I want to thank the speakers. Professor Lynn, thank you so much for your time. thank you, and Collins, thank you so much. We know you are all very busy people. So this 1 hour is something that we value and appreciate. And we thank the 102 participants that actually tuned in and listening, asking the questions. And we hope that at the end of it, all of us will move forward and innovate in the different in the different work that we do. And you can follow Nigeria Health Watch Advocacy on this, on through our social media handles, using the hashtag Innovate for COVID-19.